Hello, my name is Azalea Cullifer and I'm a student at UW Psych, and in this class's PSA, I wanted to talk about a problem. This problem actually shows up a lot in women's healthcare. The problem being, women and female-presenting people are often present in the healthcare system, but that doesn't automatically mean that they feel safe, heard, or believed. My broader topic is women being overrepresented in healthcare, but underrepresented in systems that are supposed to help, lead, heal, and protect them. And the part I'm focusing on is kind of specific, which being, how can we better understand and or help women feel safe, heard, and believed in healthcare instead of feeling discriminated against, dismissed, or diminished? And I am coming at this as not only someone who cares about the research and does research adjacent to it in my field, but also as a woman with chronic pain disorders and conditions that can understand the extreme range of the topic, of which I hope I can provide valuable insight. In which case, the first issue I want to talk about for exploring why women don't feel safe in healthcare is credibility. A female patient can be in pain or be scared or be asking for help, and they still feel like their main job at the appointment is making sure they are believable. Werner and Maltriud explain this clearly in their article, "It is hard work being a credible patient." And they studied women with chronic pain disorders, mostly muscular pain, and found that these women had to work very, very hard to make their symptoms seem real, physical, and serious enough. Their pain was not always visible, so the appointment became partly about managing how they appeared. A lot of these women in the studies reported being told things like, "You don't look ill," and "You always look so healthy though." And this can make a patient not only feel like their body has failed to provide enough evidence, but it also makes a patient feel absolutely hopeless in their endeavor to finally end their physical suffering. And this is where healthcare can become unsafe emotionally and also very mentally taxing for women with chronic illnesses to always have to need to deal with, especially on your own. Because a woman learns that sometimes honesty may not be enough, and they may start thinking about how they look, how they speak, how they act, how much emotion they show, how they should amp up their pain, should they not, should they act clueless, and finally whether or not the doctors will actually decide whether or not they seemed credible enough. This actually connects to a larger gender pattern. In an article published in the National Library of Medicine entitled "Brave Men and Emotional Women" by Samolowitz and colleagues, reviewed gender bias in chronic pain care. They explained that men with pain are often associated with being stoic and quiet, while women are often associated with being too emotional, sensitive, or complain too much about their pain. And that's a very important topic here because that exact stereotype actually affects both groups. Because men can be pressured to hide their pain, while women could also be punished for reporting it. And this is even more important because consider if men are taught not to speak up about their pain ever, so their true numbers don't actually get recorded, while women feel less pressure to act strong or macho, then that causes them to report more, and it causes the data to reveal a fake narrative of pain from men to women. Because it causes the data to show a severe statistical difference in the two groups that aren't actually as deep as they seem. And that, incidentally, to a few providers and people, may end up in them wrongly interpreting women as dramatic or weaker instead of recognizing that men may be underreporting instead, meaning that the stereotype kind of keeps on feeding on itself. And the issue is not that women are too emotional, but the issue is that women's symptoms are often read through a emotional lens before they are fully investigated as physical symptoms. Smolowitz and colleagues also found that women's pain were also mostly likely to be interpreted as psychological, and some studies reported women receiving less effective pain relief and more things like antidepressants, antipsychotics, and mental health referrals. And that kind of shows how quickly physical pain can be moved in the category of mental or emotional or girly, especially when the patient is a woman. This doesn't mean that mental health is not real or important. It just means that physical symptoms should not be just dismissed as psychological just because the provider doesn't immediately understand them because the person is a woman. Meaning that one answer to the question, how can we make women feel safer and more heard, is that providers need to treat testimonies as evidence. Especially with more invisible pain, for example, fibromyalgia, the patient's words matter more. And a lack of visible proof should not automatically become proof that the symptom is exaggerated, fabricated, dramatic, not urgent, etc. But the problem is not only individual doctors, though, but it's about who gets power in healthcare. And in another article published by the Annals of Global Health, More Women Must Lead Global Health by Batson, Gupta, and Berry, point out that women make up 70% of the health workforce, but only 25% of senior health organization positions, and only 5% of top organization positions overall. Meaning that women are doing much of the work in healthcare, but are still very much not equally represented in the leadership of said healthcare. Think doctors and surgeons. This is massively important because leadership affects what gets researched, funded, treated as urgent, or even ignored. And if women are missing from those rooms, health experiences can remain secondary to women, even when women are the majority of the patients and workers affected. And that doesn't mean that men can't listen to women or can't treat women well. They can. It's just that as a system, we should not depend on women being lucky enough to find one male doctor who finally listens. Nor should they be able to leave the research on human female bodies to men only, given that the only thing they can do is speculate on the experience of it. And this is why representation means so much, because if women's pain, reproductive health, and chronic illness and experiences of dismissal are not represented in leadership, then they're easy to minimize in policy and training. But at the same time, patients now still need the tools right now. And that's where another article, Become Your Own Advocate, Advice from Women Living with Scleroderma, by Mendelsohn and Poole come in. Become Your Own Advocate, it is shown that women with chronic illnesses often have to advocate for themselves when a doctor's answer doesn't fully make sense. And the point is not that patients should act like doctors, but the point is that women should be allowed to question their care and ask for explanations and then push back when something feels wrong. And a good core topic for this is really learning how to question your doctors and understand what you need in your doctor, and to not be afraid to switch, question, or rebuttal. And the main thing here is that patients need to know whether they can ask questions and actually get clear and honest answers. This brings me back to the main question. How can we better help women feel safe and heard in healthcare? First, medical professionals need more education on gender bias, especially in chronic pain and invisible symptoms. Providers need to understand that women's pain has historically been dismissed, psychologicalized, and minimized. Second, doctors need to be careful with language. Saying things like, "oh well, you look healthy," can feel invalidating when someone's already going through invisible pain. Third, men should be encouraged to speak up and speak honestly about their own pain. If men hide pain because they think silence equals strength, it reinforces the idea that people, like women, who speak up are exaggerating. Fourth, women need practical self-advocacy tools, not because the burden should be on them, but because the system isn't near fixed yet. Patients deserve to know how to ask questions, request referrals, and protect themselves from being dismissed. Fifth, healthcare needs to be more proficient in women leadership. Women should not only be present in healthcare as patients, nurses, and caregivers, but they should also be present as leaders, decision makers, doctors, researchers, etc. And finally, we need to raise awareness so women stop blaming themselves. And when they are dismissed, someone doesn't leave an appointment feeling like they don't know what to do. The overall point is that women should not have to earn belief by presenting their suffering the right way. They shouldn't have to prove that they are calm enough, sick enough, informed enough, or polite enough to receive care. Healthcare should treat women's symptoms as real from the beginning. It should support self-advocacy without making patients carry the whole of the burden. And it should train providers to recognize bias. And it should include more women in these leadership positions, and it should make room for the fact that invisible pain is still pain.